Imagine you have just been in a car wreck. If you are unconscious and do not have your ID, how will doctors know who you are and your vital medical information? Verichip, a new technology created by Digital Angels Corporation and approved by the FDA in 2004, has revolutionized the healthcare industry as a new, convenient way to identify patients and access medical records. Today we will inform you about Verichip and its potential uses in the healthcare industry, specifically in the nursing field. We will then inform you of the potential benefits and drawbacks of using this technology in a hospital setting. The device, about the size of a grain of rice, is injected beneath the surface of the skin, usually on the back of the upper arm. When scanned, it transmits a unique number which is entered into the Verimed database. The database contains information such as medical records, living wills, power of attorney, name of healthcare agent, do not resuscitate requests, and an organ or tissue donor card. The Verichip could greatly improve modern healthcare. With Verichip, unconscious patients can quickly be identified and their medical history can be located immediately. Likewise, patients with dementia or Alzheimer's can be identified without having to wear clunky, easily misplaced bracelets. Another improvement provided by the Verichip is a cut down on paperwork and mistakes associated with paperwork. By simply scanning a patient's arm, preliminary paperwork in a waiting room could be eliminated. With the unique numbering system, a scan would allow for the correct medication to be administered. Though the Verichip could provide improvements in healthcare, it does have its drawbacks. The Verichip can cause adverse tissue reactions and compromise information security. The Verichip has also been shown to move from the injection site, increasing time spent locating medical records. There have also been problems reported with the chip causing interference with MRIs and electromagnetic machines. There is potential for the Verichip to complicate the nurse-patient relationship. If the chip has moved, valuable time is wasted searching for it. Some critics argue that the numbering system employed by the Verichip dehumanizes patients and decreases nurse-patient relationships. Another issue with Verichip is protecting the patient's privacy. If the system should crash, the patient's files would not be accessible for their treatment. To utilize the groundbreaking technology of the Verichip, nurses would have to familiarize themselves with how the chip is inserted and where to scan for it. They would also have to understand how to input the data received from the Verichip, as well as how to remove it. The Verichip would greatly improve access to patient information and decrease time and paperwork if functioning properly. With a quick scan, nurses can administer the correct medication based on a unique numbering system. However, flaws in the system, such as migration of the chip and faulty equipment, could increase nurse and patient frustration.